Mojisola Adeyeye. So wherever we go, we try to have a close relationship with the school slogan and with what the students know themselves with. So I'm going to say GSTC and I want to listen to your response. GSTC. GSTC. And for the last time, GSTC. So we are glad to be here today among esteemed students in the esteemed college. So the principal and other members of the management team of the school, our NAFDAC Consumer Safety Club coordinator, and all other protocols that were observed in the first speech that I gave. Let me stand on that protocol and to give is an abridged version of the speech of our Director General. So we are delighted to be here today for the inauguration of the program we call NAFDAC Catch Them Young in your school today. The focus of this program is on drug abuse, education, and awareness campaign on the menace of drug abuse in Nigeria. It is extremely important because of the segment of the nation that is most affected by drug abuse. And it is our youths that are actually most affected and our teenagers. NAFDAC, as part of our mandate, seeks to collaborate with stakeholders on drug demand reduction. And in one of the strategies we are using is this campaign in secondary schools to check the menace of drug abuse among young Nigerians. It is estimated that 14.4%, or that is 14.3 million Nigerians, are victims of drug abuse. And this is a very alarming figure. You can imagine 14.3 million Nigerians are affected by drug abuse. And research has also shown that out of these 14.3 million, if you take 4 of them, at least 3 of them have been involved in one issue of crime or the other, have been arrested for one issue of crime or the other. So it goes to show that anybody that is using drugs will eventually be involved in one criminal activity or the other. The NAFDAC Catch Them Young program is comprehensive and coordinated intensive program focused on secondary schools and is designed to reduce the prevalence of drug abuse among secondary school students. Drug addiction can arise from both legal, such as prescribed medicines, and illicit drugs. So this program is not designed to scare anyone, but is to have honest conversations with you. So this will help you to take informed decisions with regards to illicit drug use, including alcohol consumption. So it takes us to the definition of drug abuse. What is drug abuse? Well, let's start by defining a controlled drug. What are controlled drugs or medicines? A medicine or medicinal substance that is strictly controlled by the government because it may be abused or it may cause addiction. The control applies to the way the substance is made, the way the substance is used, the way the substance is handled and distributed. The policy thrust of NAFDAC is to ensure availability of controlled medicines for licit use while preventing diversion to non-medical and illicit use. What we are trying to say is that for drug addiction to happen, sometimes the drugs that are prescribed to people for use from the hospital, some of them can be abused and it can lead to addiction. While there are certain drugs that we know this one or anybody that is using it, it was based on choice to go and use something that he knows will cause him to become maybe high or to have a kind of sense of pleasure. So, I give you an example. When somebody is coughing seriously, there is one drug, one medicine that is called codeine, that is codeine cough syrup. Now, this codeine cough syrup is very, very effective. Maybe you are coughing, you cannot sleep in the night. They will just give you this codeine cough syrup, probably 10 mils of it, and the person will be able to sleep well. But now you will see those who abuse this drug, they can carry a whole bottle and they will just take it so that they will feel very, very high. So in as much as this codeine cough syrup has a very good and legitimate use for treating cough, now some people are using it in a way that it is not prescribed or recommended. On the other hand, there are drugs, there are things like marijuana that you know, anybody that is smoking that one, it is a choice to go and use something that is not good. So there are some drugs that are licit, that has genuine use, that can cause addiction, and it needs to be controlled, while there are some that you don't even have any reason to use it. I like interacting with my students when we are having this kind of discussion. So I want you to give me the examples of other drugs that you know that in our community is abused. Things that people take together. Yes? Can you tell us?
Peace Corps.
Say?
Peace Corps.
You can take this one down so that we hear it very well. Peace Corps, right? Okay, we have had that. Peace Corps. Yes, just move it around, let them be. Codoline, okay.
Ezipulon.
Sorry?
Ezipulon. Ezipulon.
Preg.
Yes.
Ziplon.
Yes. Ezipulon.
Ziplon. Okay, so you see, they are even aware of some that me I don't even know. Okay, yes. Yeah. Nice. Indian hair. Yes, good one. Totoli. Cough syrup. Ice. Oris.
Sukuda.
Strong. Exol. Yes. Good. Tramol. That is tramadol. Yes. Weed. That is another one. Another name for marijuana. Okay, you wonderful students, clap for yourself. So you could see that in our community there are many things that.
Let's noise.
Okay, you can see that in our community there are many things that are abused, and the earlier you know it, so that you resist the temptation to taking them, the better. So we have done an exercise highlighting many things that are common in our society that people abuse. Somebody mentioned that tramol or tramadol. Tramadol is a very, very good pain reliever when taken at the prescribed dose of maybe 50 milligram or 100 milligram. But those who have the bad intention of using it to feel high, they can take almost, in fact there is one, the one they smuggle into the country is not registered by NAFDAC, that is about 235 milligram. Meanwhile, what you require is just 50 milligram or 100 milligram when they are prescribing it for pain relief. But these people, they smuggle it in, and at 200 milligrams, it's like you are taking 4 tablets of the one of 100 milligram or 8 tablets of the one of 50 milligram. So there is no good intention in that at all. And there are so many other things. Even, okay, some of you forgot to mention alcohol. But alcohol is